Respiratory Innovation Wales, proud to support Welsh Government and innovation partners at Arab Health and the UK Pavilion Expo 2022.
So, what is CERi? CERi is a Watson virtual assistant, and basically it uses a method of AI called natural language processing to understand dialogue, and in this case conversations and general questions about COVID-19 from both a staff and from a patient perspective. CERi has been trained by both clinicians and patients who've had COVID and focuses on general conversations about things that people frequently ask about COVID. And these are wide ranging and varying from can my dog or pet catch COVID to what detergents or how should I kill COVID in the household. So it's very specifically aimed at non-clinical questions about COVID-19, and also it keeps updated about the new advice that comes through from either Public Health Wales, Public Health England or other trusted sources of information around COVID-19. Why did we build CERi? CERi was built because of a significant demand from members of the public and particularly staff asking general questions about COVID-19, especially in relation to isolation and in terms of return to work after previous isolation episodes. We found that our HR department, in particular occupational therapy, were getting inundated with calls internally from staff asking these questions, and a growing demand from the public asking about the definitions around some of the rule sets around social isolation and general queries around COVID. It was getting to the stage where most of the department was spending a lot of its time, particularly in the first wave of COVID, just detailing and answering questions that were repeated and high in volume. It's a perfect scenario to develop a virtual assistant in, and in collaboration with IBM Watson and Meridian IT, we thought it was a really good use case to develop a specific chatbot that answered general non-clinical questions about COVID-19.